protecting the people we love and coming together to stop Sacramento's fentanyl and overdose tragedy. Here, this man is doing the posture of a fentanyl fold. According to Jessica Shearer from the Addiction Center, 2025, this phenomenon is caused by fentanyl taking over your central nervous system, causing neuromuscular dysfunction in the body and forcing the person to be folded over. This could be somebody that you love, somebody that you care about. Could you imagine, losing somebody over drug addiction and the impact that would have on the community and your family? Could you imagine somebody you love taking a pill that they didn't know was laced with fentanyl and they died? This is a tragedy that's happening here in our community in Sacramento, and I'm going to walk us through it. So to give you an idea of how the severity of fentanyl, according to the CDC in 2024, fentanyl is a powerful synthetic opioid and is 50 times stronger than heroin and 100 times stronger than morphine. The DEA explains that just a tiny amount, just this amount on the tip of a pencil, can be a dosage that's lethal to somebody. So we can see how that would be detrimental. The CDC in 2024 states that because of its strength, drug dealers are mixing it with heroin, cocaine, methamphetamine, and fake pills that the user is unknowingly aware of, or not aware of. So this is a huge concern. And also, however, on the other hand, fentanyl is also being used safely in hospitals as a way of sedation and managing severe pain. But mostly, it's when it made illegally and distributed without regulation is when it becomes a huge concern for the community. Today, we are going to explore how fentanyl has made a disturbing impact on the drug abuse and overdose crisis here in Sacramento. I'm going to share some solutions that are being used today. I'm going to, we're going to talk about the support that is growing access to Narcan and community-driven programs that offer support, and finally, how each one of us can help. Two major ways that the fentanyl crisis is affecting and impacting Sacramento is number one, the number of overdoses in Sacramento, and number two, the devastating effect of addiction that's happening to the vulnerable population of the community. According to the Sacramento Bee of 2024, Sac County had 400 fentanyl-related overdoses in 2023, more than any county in all of California that year. Many were fairly young people who unknowingly took the risk of taking a pill laced with fentanyl, reported by Prabha at Cap Radio in 2022. Williams shared a story on the Sacramento Bee in 2025 of a mother in Rancho Cordova who lost her 19-year-old son to taking a pill that looked like this. It's called rainbow fentanyl, and it looks like candy. And he had no idea that it was had a deadly substance in it, and she lost her child. And as a mother, to imagine this devastation, it makes me concerned about the youth in our community. But this extends farther than our youth. It affects nearly anyone. And however, it also affects our homeless population and people already struggling with addiction, according to Safer Sacramento 2024. This drug has the potential of entering into every class of society It is affecting our neighbors, our friends, our sisters, our sons. Addiction is a curse. It traps people into cycles of poverty and unstable living conditions, making it harder for them to recover, according to Safer Sacramento of 2024. Fentanyl also makes drug use far more deadly. It is harder to predict. It is more likely to end in an overdose and death, according to Substance Abuse of Mental Health Services Administration in 2023. It's important to note, however, that fentanyl wasn't always such a threat. Dr. Anaya Madal stated that fentanyl was approved for medical use in the United States in 1968 as a powerful anesthetic and remains a useful tool today when used properly in medical fields. However, even if fentanyl is prescribed to you, being that fentanyl is such a powerful opioid, it's actually extremely addictive. So according to the National Institute on Drug Abuse in 2025, they stated that fentanyl changes the way that your brain activity functions and makes people want to continue using the drug, even if it has negative effects on their body, and people quickly can lose control over the use. Now that we have discussed this affecting our community, let's take a look at some of the solutions that are already helping but need more support. One of the most effective ways that is being used is Narcan. Narcan is a medication that is used for reversing opioid overdoses and blocking impact on the brain. It is a nasal spray written by Safer Sacramento of 2024. And the reason why it is so effective is because of how easy it is to use and how easy it is to be trained to use. Another tool would be to support local organizations. According to the Sacramento Bee, the Neighborhood Wellness Foundation provides outreach, education, and trauma support, which helped to drop fentanyl-related deaths by 56%. We need to continue more access to Narcan, more education in schools, and provide more recovery programs to help reach people in our communities. Education, supporting awareness, campaigns, advocating for increased funding, and encouraging your community are all ways to get involved and be informed. To start, it's important and helpful to just become educated, to start talking about the dangers of fentanyl, to help others become aware of this dangerous situation in our community. We can open conversation and help people to feel comfortable to ask for help, to get support, and help people to begin recovery, to feel safe. We can choose to be empathetic and instead of judgmental, and to see situations from a different point of view. Supporting by promoting and participating in education campaigns, both in schools and online, can be especially crucial for the youth of our communities. We can reach out to government officials and Sacramento city leaders, our mayor, city council members, and write them letters and emails. They have the power to allocate funds and more resources towards prevention, harm reduction, and treatment centers. By being educated, supporting awareness, and advocating for funding, we can help strengthen our community and support those affected by fentanyl. In conclusion, fentanyl and the drug overdose crisis in Sacramento is not an irrelevant issue. It's happening here and it's happening to our community. It's important to take action, to do our best to reduce exposure. The use of Narcan, the work of community organizations are making a difference, and it is vital to help just continue this support by taking sincere action, by spreading awareness, writing letters to political leaders, and educating those around us. Real change happens when we care and take enough time to speak out and support solutions. We can have a perspective of selflessness, and we can see things in a whole new way, leading us to make real positive impacts on our community and potentially saving loved ones, and hopefully taking away from the impact of the tragedy of fentanyl. Thank you.